while to gather health information of the residents nearby the airport.
Did we just did we conclude anything?
You know, I don't know that there were any specific conclusions from the panel. You might remember that better than I. I think the conclusions were, one, to do a health study would be challenging. The reasons would be, one is to try to isolate exposures that come from the airport versus all the other sources of air pollutants. The second challenge is in trying to apportion any health effects that might be found to those emissions and separate those out from other things that cause us disease, including things we do to ourselves, you know, like our diet or cigarette smoking, things of that sort. So I think the conclusion was that it would be a high challenge, and the last panel meeting, I think, was encouraging us to try to seek some sort of funding to come up with some basic support for at least some initial studies. Did I get that right?
Well, I know you got a lot of you're doing, and this is a little time off, and yeah, that's pretty good summary. I think the only thing I would add is that we did pretty much unanimously agree that collecting a good set of data about the ground operations of the jets aircraft at the Santa Monica Airport would be useful. But let me move on to, I'm sorry if I put you on the spot. Let's move on to Cyrus Rangan from the County Health Department. Thank you.
Excuse me. Thank you. For those of you who don't know me, I'm from the County Health Department, Cyrus Rangan, and I am both a pediatrician and a medical toxicologist. And so my focus at the Public Health Department is the assessment of toxic exposures on human beings. And I've been with the Health Department now, it's going on about 5 years, and we do a lot of gathering and analysis of health data. And if there's one thing I've learned in the last 5 years, it's the difficulties and limitations and misdirectedness of gathering and analyzing health data. And there are a lot of inherent difficulties whenever you approach a situation like this. And to echo a sentiment that the councilman brought up earlier, he said something about how it's difficult to accomplish a lot of things on a local level. When you expand to the larger levels, things can get accomplished a little bit more readily and more efficiently. And I think that sentiment pervades what we do in health research as well. When you look at smaller and smaller and smaller communities, it gets much, much more difficult to establish good studies that demonstrate statistically whether there's a difference in health or there's not a difference in health. When you look at much, much larger populations, you look at nationwide data or even countywide data, then you have a little bit better picture, and you can have numbers that plug into mathematical formulas a little bit better, and then you can get health data that you can rely upon. So there is sort of a catch-22 issue when you look at a situation like this, that we might be looking at two issues in terms of environmental exposure. There may be this chronic issue about the elevations of air pollutants that may contribute to chronic disease and perhaps the development of cancer or the development of diseases that last a lifetime, or maybe even cause premature death or something related to that spectrum. There's also the question of acute exposures, and by acute exposures, I'm talking about the short-term kinds of exposures that you may get from, let's just say, one jet that's on the runway revving up and throwing a bunch of pollutants with the air into the local environment. And when you look at that kind of an issue, that's where you think the money would be, and that's probably where it's most difficult to study what's going on. And I agree with everything that Dr. Hospital just brought up in terms of the limitations of doing that kind of health monitoring. Now, all that being said, I think we have a lot of issues here that are definitely able to be tackled in a way where we can rely on other people's data to establish that there that there's an issue to be looked at here. For example, there's been a lot of discussion about the noise issues, a lot of discussion about the odor issues. And I know a lot of folks here have heard sort of the standard kind of party line on odors, which is that it is, it's a difficult thing to study. It's what people smell is often lower than the toxic levels that are established by the EPA, et cetera, and that's all very, very true. On the flip side of that, there are some rather credible studies out there that show that the odor issue can actually have a medical and physiologic impact on people. So just because we don't have toxic levels of pollutants, or if that's what we end up finding is the case, whether it's on a daily basis or the monthly basis or the yearly basis, sure, there could still be some health effects strictly related to the fact that people are smelling noxious odors or experiencing a lot of problems with noise. And there are some pretty interesting studies out there that have attempted to research this issue to show that, yeah, these kinds of things can contribute to high blood pressure, stress levels, even medical evidence of anxiety disorders, all kinds of things. So there are actually real medical, physiologic impacts that can be borne out from some of these other issues, which are, in my opinion, much more easily identifiable from a health standpoint in this situation than looking at some of these pollutants and trying to figure out how it's getting to an individual person and then correlating that with a certain kind of health effect. Now, obviously, there's going to be a lot of questions about a lot of these issues, and we can answer them along the way. But what I do want to emphasize is that there are some big differences between doing strict medical research versus doing sort of health surveys and epidemiology, which is sort of the kind of thing that I do at the health department. And we've done a lot of epidemiologic studies in the past, and I've iterated this here before, and I know we've talked about it, Mr. Rubin, we've talked about this issue a lot, about the limitations of these kinds of studies, and I can tell you almost invariably, when you do the kind of quick, dirty epidemiologic study that seems like the easy way to prove something, invariably it turns out to be a not so great study, and you're always going to find people who are going to be able to discredit the study. You're always going to find people who are going to say, well, pretty much everything looks fine here, or everything looks like here like it looks like the rest of the county or another region, and you end up kind of shooting yourself in the foot, and it ends up being a lose-lose situation for everybody. Now, if you really wanted to do the kind of study that we kind of had a wish list going on with our scientific panel as we discussed this a couple years ago, and we had a wish list of all kinds of things that we could do, and it's sort of a difficult situation. Just as Gene had said, the model kind of medical research study that you would want to do is the kind of thing that would take probably, millions and millions of dollars upon many years in order to complete. So we have to try to figure out what we can do with what we have, and I think we can hopefully find some direction with that tonight. Thank you.
Thank you, sir.
Good evening. How many people were at the town hall meeting 2 years ago? Good for you. It was a pleasure at that time to hear your comments and concerns. Many of us, I don't live in your community, but was heartfelt to hear your concerns, and clearly being cognizant of the airport and been around the airport for as long as I have and study the airport, I truly feel for your concern. And it was every hope and wish to assist Marty and the community at large and the councilman to get to the bottom of this, to see if we can get information that we could use to try and better your quality of life. That is really what we're trying to do here. I think it's obvious just by the noise, the odor, and your intuitive nature that the airport has some impact on your life. What do you think? I mean, pretty much, I would think you're me too. The problem is that, we want to get information that's concrete to help us make some educated decisions about how to possibly correct some of the problems. And you hear about data collection, you hear about studies. I think it's important to realize there are a lot of different studies and a lot of different data you can collect. And I think that gets very much jumbled, and that you don't understand that what I might refer to as data and study is not quite the same as what Dr. Rangan is referring to or Dr. Hospital is referring to. And in fact, that is the case, because our disciplines and our approaches are all different. Where Gene and his agency would typically lend to monitoring and collecting air data, have the monitor out there, suck the air in, collect the samples, and have it analyzed. Dr. Rangan